Hi, my name's Haley McLaughlin, and today I will be talking about how vegetables lower your risk of cancer. So, we'll be talking about plant-based diets and their overall benefits. We'll discuss how plant-based diets help the prevention of cancer overall. Relevant research regarding plant-based diets connected to cancer prevention, and some studies that have been done on vegetables and cancers linked. So first, we will talk about what is a plant-based diet. A plant-based diet is a diet that consists of all foods that come from plants or the ground. This contains a low amount of foods that come from animals and more products that are fiber-rich. So, some benefits of a plant-based diet is lower LDL cholesterol, high in fiber, you have better blood glucose, and it also improves your blood pressure. There's many different benefits, but all of these are just some examples of a couple. So, we obviously want to know exactly how plant-based diets reduce your cancer risk, so we'll talk about that in the studies. How does this diet reduce cancer risk? So, cancer is a disease in which abnormal cells divide uncontrollably and destroy body tissue, and vegetables are fruits and vegetables that are high in fiber, vitamins, minerals, antioxidants, and phytochemicals that in combination help to reduce the risk of cancer overall. How does cancer and vegetables connect? So your diet has a really big influence on cancer risk, and studies have shown that a total of 30 to 35% of cancer deaths can be linked back to your diet. And a balanced diet means vegetables are included too. So a meal that is a complete meal is made up of 25% of vegetables. Vegetables are obviously really important, so you want to have an even plate. So 20% of your diet should be fruits, 20% should be dairy, 30% should be grains, and 30% should be vegetables. So now we're getting into the first study that I looked into. So the goal of this study was to do research based on different diets that people have, and this made researchers look deeper into correlations between different foods and diets and their cancer risk. And then this type of study was a correlational research study. The methods that they used was the key changes were increasing body weight and increasing the risk of cancer. So the foods that cause this are from animal sources, caloric sweeteners, and highly energy-dense beverages and foods. So this evidence overall concludes with the importance of the environment, food availability, and dietary patterns that you have are related to the person's overall cancer risk. And then in conclusion of this study, the plant-based diets are more cancer preventative and lessen your chances of developing cancer over many, many years. The second study that I did was a case study. So this study aims to see the results between regular meat eaters, vegetarians, and fish eaters with the percentage of cancer risk. the methods that they used was they took British participants between the ages of 40 and 69 years old and recruited them to the UK Biobank study and completed questionnaires about how often they ate meat and fish in their diets. And the people were put into 4 different groups, which were regular meat eaters more than 5 times a week, low meat eaters that are 5 times a week or less, and then fish eaters, which obviously do not eat meat but they eat fish, and then just vegetarians. So in conclusion of this study that had been done, they compared the regular meat eaters that have the risk of developing any cancer was lower than the low meat eaters, which is 2% less, and the fish eaters are 10% less, and the vegetarians were 14% less at risk. So that obviously is a really, really, really big gap. 14% is a good amount. So the absolute reduction in cancer diagnosis for vegetarians was 13 fewer per 1,000 people over a decade in comparison to the regular meat eaters. Study number 3 was an animal study. The goal of this study was to see if consuming vegetables lowers the risk of colon cancer at the post-initiation stage. So for method, the researchers injected male Wistar rats with dimethyltryptamine 1 time a week for 2 weeks. And in conclusion, with both Apiaceous and Cruciferous diets that were all vegetables, aberrant crypt foci were reduced overall. So, in conclusion, plant-based diets are proven to reduce your overall risk of various different types of cancer. The male rats study showed that even with a cancerogen in their body, the overall consumption of the vegetables reduced the overall cancer risks. The overall impact of eating a vegetarian diet is proven to reduce cancer than regular and low meat eaters, and you should always find cancer before it forms.